for All plan. Steve Bratner is here with charts as well, and you're looking at health care from a couple of different angles, Steve.
Yeah, last week Elizabeth Warren released detailed figures on how she would pay for her plan, and the advantages, she has detailed figures for the first time. The disadvantages, we've all had a chance to look at them, and Joe Biden is not wrong with what he says. So let's start by taking a look at the overall healthcare picture in this country, and we're looking at 10-year numbers for the next 10 years. And we would spend a total of $59 trillion, and these are Urban Institute numbers. These are very nonpartisan, well-accepted numbers. $59 trillion would be spent over the next 10 years. In a normal world, the federal government would spend about $17 trillion of that, and the balance would be private and state, as well as spending outside of Medicare, private people who pay directly and things like that. And then if you go to Medicare for All, there's an additional $7 trillion of costs that are associated with that. What Elizabeth Warren would do would be to add to this green pie chart of what is already being spent. She would take into the federal government these two pie charts, and that adds up to the $34 trillion. So Joe Biden is right. She would take on $34 trillion of additional costs to the federal government. So let's take a look at how that fits into the government's overall fiscal picture. This chart goes all the way back, Joe, I'm going to channel a little bit of Meacham here. This goes all the way back to 1930. And if you go all the way back to 1930, at the beginning of the Depression, the federal government took in about 2.8%, was about 2.8% the size of the economy. By the time FDR got done with the New Deal, it had moved up only slightly to about 7.5%. And then came World War II, and you can see how it jumped up. But since then, it has stayed relatively steady in this sort of area, and this is a level of about 17%. What Elizabeth Warren would do is to take it all the way up to 27.5%, all the way up here. And so she would effectively add 50% to the size of the federal government relative to the size of the economy. Every dollar that passes through the economy, 27 cents of it would then pass through the federal government. So it's a transformation of the federal government unlike anything even FDR contemplated. Now let's turn to how she would pay for it, because to her credit, she put out a lot of detailed plans for every penny of it. The problem is the numbers don't quite work. So what she is talking about are corporate taxes of about $12.6 trillion, and that essentially relieves companies of the burden of health care. We can debate some aspects of it, whatever. Then she's got her famous wealth tax and some other taxes on rich people, $4.4 trillion. She's doubled her tax on billionaires. She would effectively, and this is another set of math, she would effectively tax billionaires at over 100% of their investment income to pay for this. But here's the magic asterisk. She's got $16 trillion, almost half of her pay-fors, so to speak, that are in things that are the classic gimmicks that people use when they can't get the numbers to add up. We're going to have better IRS enforcement of tax collection. We're going to cut waste, fraud, and abuse. We're going to take the Urban Institute's estimate for how fast they think healthcare is growing, and we're just going to lower it a little bit to get the numbers to work. So in addition to the size, scale, and all the rest of this thing, she's got about $17 trillion she hasn't even paid for.